Good afternoon. Welcome to this webinar on lymphedema. Thanks for joining me. By way of introduction, my name is Linda Dudas. I'm one of the senior physical therapists at Newton-Wellesley Hospital. I've been a physical therapist for over 25 years and a certified lymphedema therapist since 2000. I started the lymphedema program here at Newton-Wellesley in 2000. So welcome. We have a good assortment of participants and all sorts of different diagnoses, so that makes it interesting, and I hope I can answer most of your questions through the course of the presentation. We will have time at the end for questions, so if you don't feel like your questions haven't been answered during the program, we will have time afterwards for questions. And also, this PowerPoint presentation will be sent to, we have your email, so it will be sent to you at sometime after the end of this, so don't feel you have to be taking notes and writing things down. You'll have this to look at later. So let's get started. Okay, so here's the course outline, what we're going to try to cover. We're going to talk a little bit about anatomy. Don't be scared. It'll be a simplified version. The arterial-venous system and the lymphatic system. We're going to talk about causes of swelling that are not lymphedema, that can be confused sometimes with lymphedema. We're going to talk about the types and stages of lymphedema. We're going to talk about the treatment for lymphedema, which is called complete decongestive therapy. We're going to talk about lymphedema precautions, a little bit about air travel, which is a common concern with people who have swelling and what the research says about that. And we're going to talk about, someone asked about anything new in lymphedema. So there's some new stuff that's coming out surgically, so we'll talk about that. And then also I'm going to include some lymphedema resources at the end. So let's get going here. Let's talk for a second about the circulatory system. There's the arterial-venous system, which most of us are more familiar with. We'll talk about that a little bit. And also, of course, the lymphatic system. So this diagram is a sort of a schematic of the arterial-venous system. On the left here, you see the red vessels that symbolizes the arteries, and on the blue on the right are the veins. So if you look at the left-sided diagram, the heart pumps oxygenated blood from the heart by way of the arteries out to the body, bringing oxygen, which is our energy source, to all of our body. Our body uses that oxygen, and then the depleted blood, depleted of oxygen, comes back by way of the veins and comes back to the heart. The heart then pumps that deoxygenated blood to the lungs to pick up all that oxygen that it needs, and then the lungs send it back to the heart, and then we're back on the left side where the heart pushes out that oxygenated blood from the heart to the body. So that's kind of what you think of when you think of the arterial-venous system. Things can go wrong with the arterial-venous system. So one cause of swelling is venous insufficiency. This is actually the most common cause of leg swelling in persons over 50 years old. Venous insufficiency is often associated with obesity and varicose veins, but not necessarily do you have to have those two, but it is often associated with those. Oops, it's not. What are you doing? Okay, so here's a diagram of the veins. On the left side, you see a healthy vein valve. So here's the valve in the vein. The blood, symbolized by the red dots, is going up the vein, heading on its way back to the heart. As it goes up, the valve closes, keeping the fluid from going back down toward the feet and ankles and the lower legs. And that's normal. On the right is a diseased valve. So what happens is the blood, again, is trying to make its way back up through the valve to the heart, but the valve isn't closing. So the blood is allowed to float back down, and that can result in swelling, varicose veins. Some of this fluid gets so congested that some of this fluid leaks out into the tissues, and that becomes swelling. A lot of people, I think in this group, might have venous insufficiency. They have non-cancer related swelling in their legs, and this may be the cause of some of their swelling. One thing you might see with venous insufficiency over time are changes in the color of the skin. So as you see in this picture, you get kind of this brawny, reddened skin starts usually down by the ankles and over time can work its way up. This is called hemosiderin staining, and it's basically the iron pigment from the breakdown of the hemoglobin in the blood gets leaked out into the tissues and stains the skin. You can't get rid of that once it sets in, but you can address the swelling that's often associated with it. Another cause of swelling related to the arterial-venous system are blood clots, also known as deep vein thrombosis. These blood clots most commonly occur in the leg, but they can also occur in the arm or the trunk, so they can cause leg or arm swelling. DVTs, deep vein thrombosis, is typically painful. It's usually of a sudden onset, and it is considered a medical emergency because those clots can break off and they can travel to the lung and cause a pulmonary embolism, which can be life-threatening. Another cause of swelling in the arterial-venous system is congestive heart failure, renal kidney failure, or pulmonary hypertension, which is often associated with sleep apnea. So if you, basically if you have leg swelling, these problems, these diseases usually affect the legs. If you have leg swelling, you would first want to be seen by a doctor and ruled out that you don't have these potentially serious diseases, which would need to be treated first before you got treated for lymphedema. Obesity can be a cause of swelling as well. Obesity can contribute to the chronic venous insufficiency that we talked about, can contribute to lymphedema and to obstructive sleep apnea, which we just saw can contribute to pulmonary hypertension. Certain medications can cause swelling. Blood pressure medications, particularly the calcium channel blockers and beta blockers, non-steroidal anti-inflammatories, so those are the over-the-counter pain medications you might take, like your Advils and Motrins and ibuprofen, can cause swelling, and steroids, such as prednisone, can cause swelling. So it's good to know that as well. So now we're going to switch over and talk about the lymphatic system. So this may look a little like, what the heck is this? But this, again, we've got the red showing arteries. Here's our heart sending blood out of the arteries. The vessels get smaller and smaller and smaller, become capillaries, exchanging oxygen, and then the veins bring the deoxygenated blood back to the heart. Down here in this it's supposed to be sort of green, represents the lymphatic system. The lymphatic system generally follows along with the other vessels, but it's a little bit different. It picks up some of the large proteins that don't get picked back up by the arterial-venous system, and it's a one-way drainage system, so it's picking up fluid from the tissues, it's coming up, here are some lymph nodes along the way, and it brings fluid back to the heart. So it's a one-way drainage system, a little bit different than this circular arterial-venous system. So that's the lymphatics. If you looked at a schematic of a person, you see that basically coming from the legs, the lymphatics drain fluid up the legs to the inguinal lymph nodes here in front of the hips, comes back up through the trunk and back to the heart. In the arms, the lymph fluid is going up the arms to the lymph nodes in the armpits, the axillary lymph nodes, and back to the heart. And the head, yes, you can have head and neck swelling. The lymph fluid from the head and neck comes down and back to the heart. So the lymphatic system is a one-way drainage system, and that's important when we treat lymphedema because we follow that pathway when we do our manual lymph drainage, and it's part of the immune system. And that's important because people who have problems with their lymphatic system are more prone to infection. The immune system is the part of our body that fights infection. The lymph fluid is also a high protein fluid, which has implication because proteins that sit around in that lymph fluid when people have lymphedema can start to make changes in the tissues in terms of the tissues becoming thicker, what we call fibrotic, and we'll talk about that in a little bit. The lymph fluid also includes, the lymph system also includes lymph nodes, as we talked about. And it circulates about 10% of our body's fluid is circulated by way of the lymphatic system. So let's talk about lymph nodes a little bit. Believe it or not, there are 600 to 700 lymph nodes throughout the body. They concentrate in certain areas, as we saw in that previous diagram, but there are a lot all over the place. The lymph nodes create or make lymphocytes, and these are cells that fight infection. So again, when there's problems with the lymphatic system, if you've had lymph nodes taken out or they're not working correctly, you're more prone to infection. And we're going to talk about that more when we talk about lymphedema precautions. The lymph nodes also filter harmful material like cancer cells and bacteria, and they regulate the water content of lymph fluid. So once again, just another little bit of a schematic similar to the one we saw before. Here again, concentrations of lymph nodes in the groin area. These are called inguinal lymph nodes. And then we've got a lot of lymph nodes in the axillary area or the armpit called axillary lymph nodes. You've got a lot of lymph nodes up in the neck area called cervical lymph nodes. And then again, all throughout the body, there's also lymph nodes everywhere. But those are the kind of the main concentrations of lymph nodes. So this is just a little bit of a closer look at the lymphatic system and just in the arm. So you'll see the green, I hope it shows up on your computers at home. The green are the lymph vessels. The blue is the veins, not showing any arteries here, but they're there. And you've got a little bit of chain of lymph nodes here at the elbow. And then you've got a lot of lymph nodes. They don't show up so well, but all this is lymph nodes in here in the axillary area. So all this tissue fluid of lymphatic fluid is coming up the arm, going to these lymph nodes, and then back to the heart. And in the leg, it's similar. What happens if there's a problem with the lymph nodes, say lymph nodes have been removed here in the armpit, you've still got fluid being created, and it wants to keep coming up, but now maybe there's a problem, the lymph nodes aren't there, so now the capacity to move this lymph fluid is decreased because there's no lymph nodes, but the amount of fluid is still coming. So you have an imbalance, fluid can start to back up into the limb, and then you get lymphedema. So what is lymphedema? Lymphedema is a swelling disorder in which the lymph load, or the amount of lymph being created all the time, exceeds the lymph capacity, which is the ability of the lymphatic system to move that fluid. So you get the backup of fluid. It most often results in swelling of an arm or a leg, but it can occur anywhere on the body, including the face, neck, torso, or even the genitals. Lymphedema is categorized as either primary or secondary. And let's talk about that a little bit. We have someone who registered who had primary lymphedema. So lymphedema is lymphedema which is due to a developmental defect of the lymph vessels or the lymph nodes. So basically someone is just born with a defect in their lymphatic system. So lymphedema is also categorized by age. By the way, lymphedema is much less common than primary lymphedema is much less common than secondary lymphedema. And actually this is reflected in our registrants for this course today. I believe we only had one who said she had primary lymphedema. All the others were of a secondary lymphedema nature, and that's pretty much what you see. Much less occurrence in primary lymphedema. But primary lymphedema can be categorized by age of onset of symptoms. So you can have what's called congenital primary lymphedema, and that's where the symptoms occur at birth or up to 2 years. So this is a picture of a poor little toddler with arm lymphedema. You can have primary lymphedema can also be called lymphedema precox, and this is lymphedema that develops after 2 but before the age of 35. This we see predominantly in females, and their symptoms generally will appear between the ages of 11 and 17. This is thought to be related to hormonal changes at that time. And then the third category of primary lymphedema categorized by age is called lymphedema tardum, and this is lymphedema which develops after the age of 35. And it can go, you can have someone even elderly who finally, their primary lymphedema finally presents itself, And probably one of the reasons is that as we age, things kind of get sluggish in all of us. And so if you have a congenital defect in your lymph system, maybe you've managed to kind of hold it at bay for a while, but then as you get older, things don't work as well in general, and then it might show up. And then the other category of lymphedema is called secondary lymphedema. And this is lymphedema due to an obstruction, damage, or an injury to the lymphatic system. So it's not something you're born with, but something that happens to the lymphatic system. Examples of secondary lymphedema are those caused by, say, malignancy or cancer treatment, infection, severe trauma, parasites, or radiation treatment would be examples. Over the course of the whole world, worldwide, the most common cause of lymphedema is actually from parasites. This is endemic in third world countries where a form of lymphedema, which is filariasis, which is a mosquito-borne parasite, bites someone. That parasite travels to the lymph vessels. For some reason, it tends to like the lymph vessels are right around the groin. And the lymph vessels get blocked, and then you get leg swelling. And you can see these two people both have lymphedema in their legs. Luckily, in this country, we don't really see this. It's generally, you might see it, but it's generally someone coming to this country from a third world country. In the United States, the most common cause of secondary lymphedema is cancer-related. And this is a picture of a woman with cancer, with lymphedema of her arm from cancer, probably breast cancer. It's the most common thing we see. So cancer-related lymphedema most often occurs within the first year or two after cancer surgery or radiation, but it can occur many years after treatment has been completed. We did have one question asking this, can it occur years after treatment? And yes, it certainly can. I had one instance of a patient that had her cancer treatment 30 years before I met her, and her lymphedema came on 30 years afterwards. What happened to her, just as a little aside, is when she fell. She was an elderly woman at this time. She fell and fractured her wrist, and she was having therapy, not at Newton-Wellesley, but therapy for her wrist, and the therapist put a hot pack on her wrist because she thought that would make the wrist move a little better, and it triggered her lymphedema. So yes, it is a lifelong risk. We categorize lymphedema into stages. There are 4 stages. Stage 0 is called latent, and we'll talk about these a little in detail, stage 2 through 3. So stage 1 of lymphedema is called latent. It means that you are at risk for lymphedema. Maybe you've had lymph nodes removed or you've had radiation, but you have no visible signs of swelling. Nonetheless, the patient may describe a feeling of heaviness or fullness in the arm. Stage 2 lymphedema is where you begin to get accumulation of this protein-rich fluid. Remember, we said that lymph fluid is a high-protein fluid. You begin to get what is called pitting edema. And this picture of these 2 legs are the same leg. On the left, they show someone pressing their thumb into the tissues. You hold the thumb there for a few seconds, and when you take it out, you see what you can hopefully see on the right, which is that indentation remains in the skin. And this is called pitting edema, which is typical of stage 1 lymphedema. In stage 1, there's really no fibrosis of the skin, so the skin is still soft, and it often reduces with elevation. So in this stage, you'll often hear people say that they go to bed at night with swollen legs, and then when they wake up in the morning, their legs look pretty normal. But then over the course of the day, the swelling returns. It's best to have treatment at this early stage. You tend to do better with treatment at this early stage. One person had asked, is it still possible to have treatment after years? They'd had, I think, as I recall in the registration information, they'd had it for 30 years or so and never had treatment. Is it too late? Well, it's not too late, but you get better results when you treat it early on. Stage 2 of lymphedema is an increased accumulation of this protein-rich fluid in the tissues. You may or may not have the pitting, and you're starting to get fibrosis in the skin, so the skin is starting to feel a little bit thicker. Stage 3 of lymphedema is also called elephantiasis. So again, the accumulation of this protein-rich fluid, which is making changes in the connective tissue, making it harder. Now you don't really have any pitting because now the skin is so firm that when you press your thumb into it, it feels kind of leathery and you don't have the pitting. So you can start to see the skin changes typical of elephantiasis, which are these papillomas, which you can see a little bit maybe, whoops, whoa, wait a minute, my computer's out of control, hold on. Wait a minute, there we go. So you can get these sort of blister-looking cysts, papillomas, and kind of this thickened plaques of skin, hyperkeratosis, typical of elephantiasis. I've had patients who come into me, I've had worse legs than this, who actually end up doing quite well, but they do have to keep up with their home program. So why do some people get lymphedema and some people don't? We don't really know why this is, but there are certain risk factors for lymphedema. In the cancer population, the more lymph nodes that are removed, the more the risk is that you might get get lymphedema. However, I have to tell you that I've had patients who've had 1 or 2 lymph nodes removed and got lymphedema, and I've had other patients or other people I know who've had maybe 20 to 25 or 30 lymph nodes removed, and years, decades later, they never got lymphedema, so we don't really know. However, being overweight is one definite risk factor for lymphedema. This has been shown in multiple research studies that being overweight increases the risk for lymphedema, certainly in the cancer population, but also lymphedema is a risk for people with non-cancer related swelling. So it's very beneficial to try to get to your ideal body weight for your health regarding lymphedema. Also, radiation to lymph nodes can cause damage to lymph nodes and increase the risk for lymphedema. So basically, there is no cure for lymphedema. However, it is treatable. And now let's talk about the treatment for lymphedema. Lymphedema treatment is called complete decongestive therapy, or CDT. This has been the gold standard for lymphedema treatment for decades, and it is multifaceted. It consists of compression, some sort of compression therapy. We'll talk about these in a little detail. It consists of manual lymph drainage, exercise, meticulous skin care, and instruction and self-management, because unfortunately lymphedema does tend to be chronic. There are 2 phases in complete decongestive therapy. One is the treatment phase and then the maintenance phase. In phase 1, compression is critical. So we use multi-layered bandages using short stretch bandages, not ACE bandages. And here's a picture of a woman with arm swelling who's having her arm wrapped. They are pretty bulky. You can see the layer she's applying right now, hopefully you can see, is the short stretch bandages. Under the short stretch bandages, the upper arm, you can see there's other layers as well. So you have some padding layers and then the short stretch bandages on top. Here's a leg being wrapped with compression bandages, and even the toes are individually wrapped because the toes can swell as well. And so she's applying the short stretch bandages and over the padding layers, which are the white that you see further up. Bandages are worn basically 24 hours a day during this phase 1 of complete decongestive therapy. They're kept on hopefully until the patient comes back for treatment. When at that time the bandages are all taken off, the limb is washed, you want to keep it very clean so you decrease risk for infection, and patients attend therapy sessions anywhere from 3 to 5 times a week during the intensive phase 1. The sessions last usually about an hour each time. Phase 1, using these compression bandages, generally lasts in the area of 2 to 4 weeks, depending on the presenting severity of the patient's lymphedema. During this time of phase 1, the patient, if able, learns how to apply the compression bandages themselves. Some people get the hang of this and some people don't. In phase 2, patients progress from using the short stretch bandages all the time to using compression garments. Compression garments help to maintain the decreases in swelling that were achieved with the compression bandages. Compression garments are worn during the day. Their patients often need to continue to use the compression bandages or bandage alternatives at night in order to keep the swelling down, at least initially. Patients with that very light stage 1 lymphedema that we talked about sometimes can skip the compression bandaging part altogether and go directly into compression garments, and that's enough to help their swelling stay under control. So again, the importance of addressing lymphedema early on, you get better results, and hopefully the treatment is a little bit more palatable. Here's some examples of compression garments. There's lots of different compression garments on the market. These are just a little sampling of some arm compression garments. On the left is a compression sleeve, and I hope you can see it goes from the wrist up to the shoulder. Sometimes people also will need something to cover the hand, because sometimes introducing a sleeve will start some swelling in the hand, but certainly if you have hand swelling, you do need compression on the hand as well. Compression garments, compression sleeves such as this are graded, so you'll see that they have a grading of like 20 to 30 millimeters of mercury, 30 to 40, and what that means is that there's more compression applied down by the wrist and then less as you go up, and this is because that fluid, remember, goes in one direction, and so that higher compression down by the fingers or down by the wrist helps to push that fluid up to the shoulder. In the middle picture there, the blue that you can see going from the hand up to the shoulder is a nighttime garment. This is a padded, quilted sort of fabric garment that you can just pull on and use at night for those patients who need some nighttime coverage, but they just can't manage to do the bandaging themselves. On the right, a little harder to see maybe in this picture, but there are Velcro-based compression garments that can be, for some people, easier to put on, and that can also be worn at night. So variations then on legs, leg compression garments. Again, on the left, you have knee-high compression stockings, which are, very easy to wear your clothing with. They look nice. You can get thigh-high compression garments. You can get pantyhose. You can get capri length if you only have thigh swelling. There's just really all sorts of varieties, different colors, different thicknesses in terms of how much compression based on how much swelling you have. In the middle picture, another sort of Velcro-based compression garment that you can get also in many varieties of just the lower leg, the whole leg, the foot. And on the right, another sort of a nighttime garment that you can slip on. So there's a lot of different options out there for compression garments. You can also wear compression garments for people with head and neck swelling. We didn't have anyone sign up today who had head and neck swelling, but that's a whole other area, and there are various compression garments for that as well as bandaging techniques. So let's now talk about manual lymph drainage, which is another component of complete decongestive therapy. This is a sort of we don't like to use the word massage, but it is sort of a massage that increases lymph vessel activity, promotes relaxation. We had someone ask about what can she do about sort of that achiness that she gets in her arm at the end of the day. That might be just that fluid can cause some achiness, and manual lymph drainage can really help that. Most people find that the limb feels much better after manual lymph drainage, and people can learn how to do these techniques themselves. They're not really that hard and can get some good results with that. So if the person who asked about the ickiness, hopefully can find someone to teach herself manual lymph drainage. So this is someone having a manual lymph drainage to the leg. The manual lymph drainage addresses the superficial lymphatics, which is where the swelling is, so it's right under the skin. Therefore, the techniques have to be very gentle. You don't want to do any kind of deep tissue kind of Reiki, not Reiki, what's that other, there's that deep tissue kind of massage for someone with lymphedema. It's always very gentle. Patients are taught also how to do their own manual lymph drainage if they feel able to do it. So here's someone doing a little manual lymph drainage up to the neck. Manual lymph drainage is performed each time the patient comes for treatment during phase 1 of complete decongestive therapy. Exercise. I'm not going to spend much time talking about exercise, but exercise is important. The muscle pump helps to promote lymphatic flow, so using the muscles helps. It's not going to do any good to sit there with a swollen arm or leg and just sit there elevating it, although elevating can help, but moving it is better. But exercise, if someone has a swollen limb, they should do their exercise with some form of compression on the limb. Compression provides a counter pressure to the forces of the muscle. So the muscle and the compression garment kind of sandwich the fluid. The muscles push up on that fluid. The compression garment pushes down on the fluid. Remember, the fluid is a one-way drainage system. It can only go one way. So as the muscle's pushing on the fluid, the compression garment is pushing on the fluid. It helps to get the fluid out of the limb. If people are doing any kind of weights, they should start with the lightest weights possible when they're starting a new routine and progress those weights incrementally so that they don't cause any muscle damage, tissue tendinitis, which can be inflammatory and bring extra fluid to the area and exacerbate the lymphedema. So you want to go gradual with your exercise. So let's talk about skin care, and we talked about the increased risk for infection when the lymphatic system is compromised. So skin care is really very, very important. Any opening in the skin over that swollen area can introduce bacteria which can initiate an infection. One serious sort of an infection that can be associated with lymphedema is called cellulitis. We had one woman write in who's had some bouts of cellulitis, and this is a potentially serious skin infection that can happen with those with lymphedema. And once you've had cellulitis, you're at more risk for recurrent episodes. Signs and symptoms of cellulitis may include, but may not have all of these symptoms, but may include, and usually does include, a rash. That is going to be there. The rash feels warm and it tends to spread. In this picture, some medical professional has used a marker to outline the rash. Because of tendency for cellulitis to spread, they want to keep track. If it's spreading quickly, it's that much more serious. So they keep an eye, very close eye on it, and want to treat it if it seems like it's spreading. Other symptoms, like I said, of cellulitis could be pain. It's usually is painful, but not always. The patient may have fever, chills, sort of like almost when you have a flu, but you might not have all that. And usually the swelling is worse when you have cellulitis. If you suspect that you might have cellulitis, you should let your doctor know. Don't wait. Mild cases may respond to oral antibiotics, but severe cases may require IV antibiotics and maybe hospital admission. It is a serious situation. So more skincare guidelines. Keep your swollen arm clean and dry, but not so dry that you get cracks in your skin. So it's important to use a moisturizer to prevent any cracking in the skin. In our clinic here, we use Eucerin moisturizer, but any good moisturizer that doesn't have perfumes and dyes is recommended. Take special attention to nail care. If you have arm lymphedema, please don't bite your nails. It's not a good idea. You're asking for trouble. Don't cut the cuticles, just push them back. And same thing with people with leg lymphedema. If you have thick nails or difficulty cutting your nails, you may want to have a professional do your nail care. Take care to protect your exposed skin with sunscreen and insect repellent. Sunburns can cause blisters that can open up, and there you go, bacteria can get in through the skin there. And obviously an insect bite is an opening in the skin and can cause not only that opening but also irritation. Use care with razors to avoid nicks and skin irritation both under your arm or if you shave your legs. If possible, avoid punctures such as injections and blood draws. Obviously, this applies to those with arm swelling, not the leg swelling. Be careful wearing gloves if you have arm lymphedema while doing activities that could cause injury to your skin, like washing dishes, gardening, working with sharp tools, using harsh chemicals or detergents. If you notice a cut or a scratch on the area that's at risk for lymphedema or that has lymphedema, don't panic, but wash it as soon as you can with soap and water and observe for signs of infection. If you notice rash, itching, redness, pain, increased skin temperature, fever, or flu-like symptoms, contact your doctor immediately for treatment for a possible infection. So just a couple other guidelines or precautions. In terms of activity, we talked about exercise, build up in duration and intensity gradually, take frequent rest periods if you're doing an activity to allow the limb to recover. I just am reminded of a patient I had who, we had a snowstorm. We just had a snowstorm here in Boston, a big one. So I had a patient who we had a snowstorm and she was impatient to get out of her driveway and shoveled a lot of snow, and that set off her arm lymphedema. So you want to pace yourself when you're doing strenuous activity. Monitor the extremity for change in size, shape, tissue texture, soreness, heaviness, or firmness. And very important, try to maintain your optimum weight. Extremes of temperature. So extremes, avoid exposure to extreme cold, which can be associated with rebound swelling. On the opposite end, heat. Avoid prolonged exposure to hot tubs, saunas. Not greater than 15 minutes is recommended by the National Lymphedema Network. We had someone ask a question about the heat. When it's hot out, her swelling is worse, and we hear that all the time because heat tends to dilate vessels. Our blood vessels, our lymphatic vessels, heat expands our vessels or dilates them. That means more fluid is getting to an area. So, and it's a tough problem because, of course, in the heat, you don't really want to be wearing your compression garments, but it is important, if possible, to try to wear your compression garments in the summer as well. I know it's a tough pill to swallow. Try to avoid placing the swollen limb in any hot water, like we said above, hot tubs or being in a sauna. A question I get a lot is about air travel. People say something like this: I've been told that air travel can cause my arm or leg to swell. Should I cancel my trip? And it's hard to tell them exactly what to do because there hasn't been a lot of research on air travel and lymphedema. But some reasons that air travel could cause swelling, and I think we can probably all relate to this. Even someone who's not at risk for lymphedema will often say that their hands and their feet swell when they're on a plane for a long time. Possible reasons for this is that there's decreased air pressure in the cabin, and actually air is a form of compression when you think about it. We have air pressing on us, and that helps to keep our vessels flowing. And when you're in an air cabin, there's less air pressure, so there's more chance to have swelling. By the way, swimming is a great exercise for people with lymphedema because when you're in the water, there's increased pressure of the water, so that helps to push fluid. Also, on a plane, sitting there for a long time, you're not moving, so there's not muscle pump activity. You don't have the muscles pushing the fluid during a flight. It's important, I tell people, to try to get up and move around if you have to be on a long airplane flight to get those muscle pumps. Even sitting in the chair and moving your ankles up and down can help. In a long airplane flight, well, I don't know, these days I guess they don't feed us much in the airplane, but if they do, it's probably salty, prepared, processed foods, and people may not drink as much water, so they get dehydrated. When you're dehydrated, your body wants to hold on to fluid, so that can cause increased swelling. And then maybe, just lifting, carrying heavy suitcases, rushing around through the airports can strain muscles, and that can contribute to, we don't really know. But what does any research say about air travel? There's this study that was done, published in 2010. Excuse me, I need a slight drink of water. Effective air travel. This was, you know what, maybe I should skip this. I think I'm going to skip this because we're running short, but it'll be in your PowerPoint presentation. Basically, the short story, the kind of the quick and dirty answer is that air travel did not seem to cause significant changes in swelling in these women who were breast cancer survivors. Someone asked what's new in lymphedema, what is anything new in the horizon? She had tried all sorts of things, the manual lymph drainage, the Velcro garments, the compression stockings, and she's still having trouble. Well, we don't have too much new, but there is some new surgeries that are being done. So this lymph node transfer surgery has been pioneered by a Dr. Corinne Becker in France. She's a reconstructive surgeon. She's been taking lymph nodes, I think, mainly from the groin. I think this has also been done with lymph nodes in the abdomen. And she's taken them and transferred them to the axilla for some of her breast cancer patients. This surgery has been seldom performed in the United States, however. This kind of surgery requires very complex microvascular surgery, so there are very few surgeons who are doing this. And there's a concern, obviously, with this because if you're taking lymph nodes, say from the groin, to put them in the armpit, are you now going to have lymphedema developing in the leg where the lymph nodes from the groin were taken out? So more study needs to be done on this. However, there have been case studies reported where people have had some improvement in their lymphedema after lymph node transfer, but not necessarily that they've had to that they've been able to completely give up using some of their compression techniques. The other surgery that's new is called anastomotic reconstruction. These are attempts to restore lymph flow through a surgical rejoining of the damaged lymph channel to either another healthy lymph vessel or to a vein, and again requiring very complex microsurgical techniques that not too many surgeons are trained to do, and this is considered a sort of a last resort. We need more study on these. I'm just going to give you some resources. These, again, will be sent to you, so you don't have to write them down, but these are some resources that you can go to online to get information, support on lymphedema. There's the American Society of Clinical Oncology, National Cancer Institute, and American Cancer Society, all for all sorts of answers about cancer-related lymphedema and cancer in general. And then to try to, if you're looking for a manual certified lymphedema therapist, these are some places you can go to.